So as we discussed in part one, most labor and deliveries are pretty non-complicated. So now we're going to talk about the what ifs. What about the complications of pregnancy? We're going to start off with ectopic pregnancy and shock in pregnant women. So usually we divide the time that a woman is pregnant for the 9 months into 3 trimesters. The first trimester being the first 3 months, second trimester the second 3 months, and then the third trimester the last 3 months. And each of these trimesters kind of have things that go along with them. So in the first trimester, like maybe the first 6 to 8 weeks of pregnancy, if a woman has a fertilized egg that did not make it all the way to the uterus, it attached in the fallopian tubes, then as that fertilized egg becomes larger, as it starts to grow, it expands and causes that fallopian tube to rupture. She's going to have pain on one side or the other, whichever fallopian tube it was, as well as internal bleeding. So she'll show signs of shock. Remember the signs of shock? You could be restlessness, like altered mental status, a cool, clammy skin, rapid, weak pulse. Usually the breathing picks up a little bit. They change color. They may become pale in color, maybe a little bit cyanotic around the lips. So those are signs of shock that they have internal bleeding. And she'll have that one-sided pain and signs of shock. So arrange for prompt transport. Not much that you can do here. It's just a matter of getting them to a hospital that has surgical capability in order and treat them for shock. So if you have advanced life support, intercept, that would be really good. At least to keep the blood pressure up with IVs. Also in the first trimester, usually in the first trimester, they call a baby viable at 20 weeks, so that's like halfway through the 40-week gestation period. And a miscarriage is delivery of the baby before it's able to survive outside the body. The big thing with this is the mother's usually pretty emotional. You know, they were excited they were going to have a baby and now the baby's gone. But any kind of tissue that passes, a lot of times it just looks like clots of blood. And at the hospital, they'll dissolve that in fluid so that they can actually see it's the fetus. And then again, you know, should they have shock, treat for that. For the most part, it's just expulsion of the baby and then a heavy menstruation. Probably a little bit heavier than usual, along with some cramping for miscarriage. That vaginal bleeding is often the first sign, so a woman who's pregnant no longer has menstruation. It's not normal to. They can, but usually when they start spotting or bleeding, then that's usually a first sign that they're going to miscarry. Anytime a woman experiences vaginal bleeding when she's pregnant, make sure you do a good history of last menstrual period. What was the date of that? You know, to find out, could they have been pregnant? And, you know, not everybody is real truthful. If you go respond to a 15-year-old female and she's having a heavy menstrual cramps and bleeding and passing clots, and you ask her in front of her mother, could you be pregnant? You know, don't expect her to tell you the truth. Again, this is the loss of a baby. They're all excited. They're painting the nursery. They're buying stuff. So make sure that you provide psychological support for a miscarriage. Premature birth is any newborn weighing less than 5 pounds or delivered before 36 weeks. Normal is 40 weeks. And they count it from the last menstrual cycle. So usually women that have good prenatal care will know that date, and they'll know their due date and everything. So a baby that's born prematurely, they don't have the fat reserves that full-term babies will have. So they're going to lose their body heat so much faster. You really have to make sure that you keep them warm. Cover their head and keep them warm. We talked about the unbroken bag of waters. Just tear it with your fingers and then push it away from the mouth and nose so that you can keep that airway open. It's a gush of fluid, so remember to protect yourself also. A couple of other things. Prolapse cord. So a woman who may not even be in labor, but the cord extends through out the vaginal opening. Well, that cord is the baby's lifeline. That cord provides oxygen and nutrients to the baby. So we don't want to shove it back in, but we want to make sure we cover it with moist sterile dressing. So this is different than your wounds, like a laceration, dry sterile dressing. moist. And the reason for that is if it dries out, it no longer functions. The other thing that you may be directed to do is insert one or two, probably 2, 3 gloved fingers into the vagina itself to lift the baby's head off of the cord. And you can tell that the baby is getting oxygen if that cord has pulsations. Remember, it's sticking out of the vaginal opening, so you can check the cord if you feel pulsations and the baby's getting oxygen. If you can't, then you want to maneuver the head off of it so that the baby can continue to get oxygen. Make sure the mother gets supplemental oxygen, get prop transport. Some EMS systems recommend placing the woman in a kneeling position. Now, this all sounds great until it's time to transport. How are you going to safely transport somebody in the kneeling position to take pressure off that cord? So it's not real practical in the field. The second complication that we're going to talk about during delivery is a breech birth. Most babies come out head first. And if a woman has good prenatal care, a lot of times she'll know, I'm scheduled for a C-section because the baby's a breech. And a breech means any other part other than the head. And usually it's a complete breech where you see the buttocks of the baby. And the baby can still be delivered this way. The only thing is, and this is kind of a good picture, it's a mannequin, but you'll place your hand on the baby's chest, and then with 2 fingers, you'll make a V around the mouth and nose. And we were always taught, you're making an airway for the baby. Well, it's not so much you're making an airway. Remember, the baby's head is the largest part of the baby coming out. So as the rest of the body comes out and passes through the cervix will close around the neck, making it very difficult to deliver the head. So that's what making that V is. These are one of 2 instances, the prolapse cord and the breech delivery, that you can insert a gloved hand into a woman's vagina during delivery. If that head doesn't deliver within 3 minutes, then that's where you think about that and inserting the gloved hand. Keep that make that V kind of a bridge across the neck so that cervix doesn't close up around the neck. Limb presentations, if you see a foot or an arm, they cannot be handled in the field. So you want to call for life transport, air transport for that baby as soon as possible. Really sad. So the mother's gone, 7, 8, 9 months pregnant, and then she notices the baby's not as active as it used to be. Maybe it's not even moving at all. And but she's in labor. If the mother delivers a baby, you have to make that decision. Are we going to attempt to resuscitate, or is there fetal demise? And usually this will be pretty easy to make, because if the baby died days earlier, they're actually kind of decomposing. They'll have a very unpleasant odor, and not even be blue. It's more of a gray, sloughing kind of color. So wrap the baby in an infant. Turn your attention to the mother, and they need to both be transported. And one of the things that most hospitals are very good about is taking that infant, giving them a bath, dressing them up, combing their hair, putting little bows in the girl's hair. And as long as the parents want to hold that baby and spend time with them, they can. So, you could start that process in the ambulance of letting the parents hold the baby, wrap them up as much as possible, wrap them up as much as possible if you're not going to attempt resuscitation. This isn't really a complication of childbirth, multiple births. Just know that if the mother still has strong contractions like she did before the first baby was born, she's probably going to have another one, or she may even tell you, I'm expecting twins. Just know that they're going to be a little bit smaller. You're going to need a whole nother OB kit or resources for the second baby. We talked about excessive bleeding. So more than 1 to 2 cups, you can place sanitary pads over the opening. You never stick anything inside the vagina. You can elevate hips and legs. You can do the fundal massage, the uterine massage to try and slow that bleeding down. If it's really severe, if the mother continues to bleed and the baby is doing really well, crying, the color's good, you probably should call online medical control. So you call whatever hospital you're transporting to and get direction to have the baby nurse. By stimulating, by nursing, the baby actually stimulates uterine contractions, which will help slow the blood flow. One little deal on trauma in women who are pregnant, especially second and third trimesters. You have to think about if there's trauma to the woman, there could be an injury to the baby. Now, most babies are really protected. The woman probably gains about 30, 35, 40 pounds during pregnancy, and only, 8 of that is going to be the baby. So it's a lot of extra fluid, the amniotic fluid, to help protect the baby. And, we were talking about miscarriage and fetal demise, the stillborns. Always remind the mom that they didn't do anything. Old wives tell a mother who was pregnant not to lift over the level of her head. Like if she reached into a top cabinet, she would strangle the baby if the cord was around its neck. You and I both know that that's not how it works. But people feel really guilty, like, oh, I did this and that's what caused it. I always think of it like this. If you could do something to cause miscarriage and hiding that pregnancy, don't you think most of the high school girls would be doing that? I mean, if going down a slide and digging your heels in at the very end would, cause a miscarriage, those girls would be at the playground all the time. So something just to kind of think about. But there is a potential for trauma to 2 patients. So if the mother's showing signs of shock, the baby's in distress also. So sometimes you maybe look at the mom and go, oh, she's not doing very, that bad, but go ahead and give the mother high flow oxygen because maybe the baby is. And if you're going to C-spine immobilize and place her on a backboard, women, especially second, third trimester, cannot lay flat on their back. They'll actually have that bowling ball of a baby compress the inferior vena cava, and it'll make her feel shocky. So you can kind of tilt the whole board to the left. One of the easiest things to do is when they're on the stretcher in the ambulance is just to take that right side of the board and lift it up on top of the handle. It just tilts the baby's weight off of there. In rare instances, a crash can kill the mom, but the baby's still there, still alive and thriving. So sometimes we resuscitate the mom to keep the baby alive until we get to the closest medical center. A little summary on this. We talked about indications of imminent delivery, and that's crowning and the mother telling you she feels the need to push, and then those close contractions. We talked about stages of labor, the first stage of labor being from the first contraction to full dilation, the second stage from full dilation to expulsion of the baby, and then the last stage of labor is the delivery of the placenta, which I kind of covered this stuff a little bit ahead of time. Make sure you have standard precautions when assisting with any delivery. There's going to be blood splatter, and you don't want to be contaminated with this. After the delivery, you have 2 patients, so make sure that you have enough care for them. If the baby doesn't breathe on their own, then you want to breathe for them. We want them crying. Best sound in the world is a crying baby. So you want them crying. If they're not crying, then you need to stimulate them a little bit more or do something to help them pink up. Most pregnancies and births are pretty uneventful, but you have to be aware of the potential for those complications that we talked about and have a plan of action. Like I said earlier, for the most part, you're going to arrive on scene for a lady in labor, and you get there and she's already delivered the baby. Nobody suctioned or did any of that stuff, and the baby's there crying or cooing or whatever. So most of it's pretty uneventful. A little bit of a review for the Emr Assisting with delivery involves determining exactly when the woman will deliver. Well, she doesn't know. I mean, we kind of have a best guess, but not exact. Transporting the pregnant woman only. No, you got to transport the baby too. Supporting the infant's head as it emerges and telling the woman to stop pushing. That's the best answer, I think. We'll look at D also, but that's it. So don't push or pull, but support. And then pulling on the infant to expedite birth, and pulling is not a good idea. As soon as the baby is born, it is important to cool the baby. No, we want to warm the baby. They were in utero at 98.6, and then they're delivered at 84 degrees or 78 degrees, and it doesn't sound like much to you, but for them, and they come out really wet, you want to dry them off. Think about this. You don't get out of the shower and just walk around, the house wet. You towel off right away, or you would cool off too much, so you want to dry the baby. Ensure the baby is dried and warm. That's a good idea. Keep the newborn's head higher than his body. Actually, a little bit lower. We let the fluid drain into the airway from the lungs. Immediately cut the cord. No hurry. There's no hurry to do that. So the best answer is ensure the baby is dried and warmed. Complications of pregnancy include all the following except. So here you're looking for the one that's not true. Premature birth is a complication. It's true. Prolapse cord, true. Breech birth, true. Multiple births, it's not a complication of pregnancy. It's just that they have more than one baby in there, so multiple births. This will wrap it up for childbirth.